I saw a GI doc do her things that she does and doesn't care about, and I am going to do this family medicine style. I don't care if you shaved your legs or wore granny panties for your annual pap appointment. I really don't care. I'm not paying attention to that. Go get your paps. I do care if you're over 50 and you've never gotten any form of colon cancer screening at all. Go get one now. I do care if you have anemia, especially if you're male and you're over 50. That usually means that you're at higher risk for colon cancer, just like that GI doc said.
Oh, what? Wait! Huh? Girl.
I do care if you're taking medication and you don't know what it's for. You should know why you're taking something. I don't care if you have an allergy to pollen or whatever seasonal, I really don't care. There's over-the-counter medications for it. You can treat yourself. I care about which abdominal surgeries you've had in the past. A C-section is also an abdominal surgery. I don't care about your sporadic aches and pains that come and go. Usually just arthritis. Take some Tylenol or some ibuprofen if it's not contraindicated. I don't care. I do care if your toddler is drinking an entire bottle of whole milk with every meal. You don't need to drink that much. It increases their risk for obesity, diabetes in the future, as well as their risk for anemia, because drinking more than 20 ounces of whole milk per day in a child can increase their risk for anemia. They only need like 1 to 2 bottles a day. I really care if you've had an abnormal pap. You need to be keeping track of if you've had an abnormal pap in the past, a colposcopy, or needed a biopsy. Abnormal paps are important because they change the frequency with which we need to have you come back for screening for cervical cancer. I do care if you've had abnormal skin lesions in the past that were concerning for any kind of skin cancer. Those are important because it increases your risk for future development of skin cancers, and especially the type of skin cancer. I'd like to know that. I do care if you've ever been diagnosed with diabetes. Even though you have diabetes, it doesn't necessarily mean that you need medications, but that's something I need to know. Increases the types of screenings that we have to do, whether it's controlled or not. Increases your risk for other illnesses. It increases your risk for damage to other organs. I really care if you're drinking grapefruit juice. Grapefruit juice does impact the way that a lot of your other medications work. And I need to know that so that I can tell you to stop drinking it and which medications it might interact with. For the ladies, I care if you're not pregnant but you're trying to get pregnant or you're actively breastfeeding. It's important because there are lots of medications that I cannot prescribe for you, or I would rather not prescribe for you if you're pregnant or breastfeeding. It might affect the baby, might affect your breast milk. You need to tell us if you're actively trying to get pregnant or if you're breastfeeding. I don't care if you drink 8 glasses of water a day. I don't care. Try to get a healthy amount of water in, whatever that is for you. I don't care. I do